Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about the splenectomy. In the splenectomy, the most common indication of splenectomy is trauma. Then what is the most common indication of elective splenectomy? The most common indication of elective splenectomy is immune thrombocytopenic purpura. Then this splenectomy is actually indicated in primary splenic tumor. Splenectomy is indicated in primary splenic tumor, and then it is indicated in hereditary spherocytosis. Splenectomy is indicated in primary splenic tumor and it is indicated in hereditary spherocytosis. In both these, splenectomy is always indicated. Then what are the other cases where splenectomy is usually indicated? Splenectomy usually indicated in the following cases, like it is usually indicated in primary hypersplenism, then chronic idiopathic thrombocytopenic purpura, then it is indicated in splenic vein thrombosis leading to gastric varices, then it is indicated in splenic abscess. So these are the cases where splenectomy is usually indicated. So it is usually indicated in trauma. It is always indicated in primary splenic tumor and hereditary spherocytosis. It is usually indicated in primary splenectomy, chronic idiopathic thrombocytopenic purpura, splenic vein thrombosis and splenic abscess. So this is about splenectomy. Okay, thank you.
Thank you and thank you for watching.